So please give a big applause to Dr. Kim Tae-young and with his presentation.
I'm going to present our experiences, especially our governmental and societal response regarding COVID-19 in the Republic of Korea. And our colleague, Dr. Chu, will present our institutional response, how to screen and how to monitor patients and etc. So it's a great pleasure for me to be with the friends in the opposite of the globe. And so we have four affiliate hospitals in South Korea. So one of the hospitals is in Seoul, the capital city. The other in Bucheon, where Dr. Chunji is. And so we are participating in this moment all together. Before talking about the MERS outbreak, COVID outbreak, we definitely need to present the situation in Korea. Because if you see the past experience since 2014 to this year, there was a large outbreak of MERS outbreak in Korea in 2015. So before that, 1 year before, in Korea, there's a big disaster of Seoul ferry. There's about 300 deaths, usually young middle school student was dead in this moment. So because of this unexpected large disaster, Korea has a very traumatized of the big disaster. So people think the conclusion of this experience was there's a failure of governmental failure of risk communication. And also, although this country is quite developed industrially, we have a lack of a proper life-saving system, which should be criticized. And also the governmental transparent organization. So everything was very disorganized at that time. So people experienced a severe post-traumatic stress disorder at that time. So just after that year, we have the MERS outbreak from Saudi Arabia. So you see the largest hospital in Korea, the Samsung Medical Center, was a big source of this outbreak. So this Samsung is a really large company in this country. So Samsung has to apologize to people because of the hospital outbreak on that moment. And also we have so this is the figure of the outbreak. Just one patient from Saudi Arabia, the index patient has spread to one large hospital, and he moved to the other hospital and moved to the other hospital. So you see the largest hospital, the 14th patient has spread to Samsung Medical Center. So, but at that time, the government decided to not disclose the name of the hospital. So people couldn't know in which hospital this outbreak occurred. So there's many criticism from to people, to government, that the transparency is really missing at that time. So probably the government at that time was reluctant to disclose every patient information to public. So after that event, Korean was very likely to want, the people wish to have the more transparent information if there's a disaster situation. So because of the unhappiest event for 3 years, so if I summarize the weakness of a Korean hospital, there's some hard truths of government people and doctors, because the medical cost is very low in this country. So the overuse of medical care in primary practice. So in MERS situation, the problem was the index patient has moved to many hospitals because the hospital is very cheap here. So this kind of a doctor shopping promotes the outbreak. So, and also the concentration issue, because South Korea is a very small country. The capital city Seoul is very near to every city of Korea. So many people living in urban other city than Seoul would come to Seoul to have the medical care. So this centralized education issue is also the weakness in terms of infectious disease outbreak. So there's a hospital everywhere, in shopping mall, like residential area near the school. So if there's an outbreak in a hospital, this could be a danger to many public. So and also the healthcare system in Republic of Korea is for Korean doctors because the National Health Insurance Service and Health Insurance Review Assessment Service, so two organizations is governmental funding. So you see, they are not generous. So we have very limited funding, limited reimbursement from government insurance plan. However, if we see the mysterious equilibrium of this country, because the national insurance, national funding is driving this hospital economy in this country. However, we have many private competing hospitals, especially Suncheonyang University is a private university hospital. So 90% of a large hospital in Korea is private. So you couldn't imagine how this large hospital like Samsung or Suncheonyang may be run by the governmental funding. So it's just like a mixture of the United States and Soviet Union. But in Korea, it works. So this low-cost efficient healthcare system run here. But there has a limitation because the population is aging. We have more and more older people, so the medical cost is increasing. So I don't know how this equilibrium will be fine forever. But however, this was working. So during this COVID pandemic, all testing for symptomatic patients was just 100% funded by government, even for visitors, foreigners, non-citizens. So if we see just a little bit of our history, the Republic of Korea is a rebuilt country after Korean War in 1950, because we have Korean War recently. But this is paradoxically successful country, I would say, because Korea is a very natural resource limited country. We don't have fuel, we don't have natural resource, and the territory is very small and divided. And also the Korean climate is very mediocre. So you have a very hot summer and a very cold winter. But if we see historically, I have heard that from between China and Korea, we have more than 14 different ethnic groups, different languages, different cultures. But only Korea have independence from China. So this is a great deal of the history. So Korea was very successfully keep independence from a great nation like China. And also we are proudly the successor of advanced Oriental civilization from China, India. So one of the successful countries which was rebuilt after Korean War. So you see how the time changed. We have the Korean War time, everything was disrupted in this country. And after recently, this country is industrialized and developed more quickly. So, and also the electronic devices, people are very, Korean hate to delay. So we always wish everything comes quickly. So for COVID testing, they never tolerate if you have the result the day after. So you should have the result quickly. So this is the kind of the culture with Korean system. And now we move to epidemiology of COVID-19 globally and also what we have experienced in Korea. I think you already know a lot about the virus and we share the same information which I don't need to probably explain, except for probably Mr. Ambassador. So this is, we have many kind of coronavirus outbreak, but this is the seventh coronavirus which reached the pandemic. So this is the picture of every morning's hospital response. So the first picture is the screening center nurses, and the second picture is infectious disease control nurses. So she is very busy to scheduling every monitoring. And third picture is the laboratory specialist. She is testing the COVID-19 testing. And you have the working nurses who are very tired and exhausted. So every morning, our chief of the infectious disease control explain this situation, national situation of COVID-19 to all staff of the hospital. So we have that kind of meeting almost every day, and now because we have a less number of the COVID-19, we have maybe one meeting every week. And this is the figure of the milestone of COVID-19 outbreak in Korea. So we have the first cases in mid-January after Chinese outbreak. So many outbreaks come from Chinese situation, but it was increased because of one particular religious group called the Shincheonji in Daegu, so in southern part of Korea. So there's a large outbreak in mid-February, and so we reached the highest number. At that time, we have the new cases more than 1,000 new cases diagnosis every day. So I don't remember how much testing we did at that time. So we did crazily many testing, and then even we have the big outbreak from one particular religious group. It seems to be controlled and getting better than thereafter. So you see the number of patients according to the city. So just a single city, Daegu, is taking almost 60% of the whole outbreak. So, and it comes from a religious group called the Shincheonji. So there's a particular, it's not Christianity, but some kind of a minority sect, which they have many young university students aggregated in small places, small churches. So that was the big outbreak in this country. And we don't have a doubt that this virus comes from Wuhan and Hubei province in China. Usually Wuhan is a city of many martial art novels. So we have historically a lot of understanding about this region. But recently, Wuhan is very industrialized city. So when I heard that this virus comes from Wuhan, I was not worried because I thought that Wuhan is just like a province or not urban or not developed country. But after seeing how Wuhan is a developed country, a region, I was terrified because it's just like Seoul. So if there's an outbreak in Wuhan, we may have the same situation in Korea because you see the number of the population, the population density, how the city is organized, everything seems very close to Seoul. And if we compare the three viruses, it was said that the fatality of the SARS-CoV was less likely than the MERS or even SARS. But it seems that if the hospital is breakdown, if you have a large number of patients altogether, we have a probably higher number of fatality than what we know from the early Chinese experience. Like I think the Korean fatality is less than 2%. It's between 1 and 2. But if there's an increase of number of at the moment of the Daegu outbreak, we have a slightly higher instance of fatality because of the older number of the older people. And at the beginning, this transmission was is known to that this asymptomatic transmission was not likely, but we have accumulated experience of asymptomatic transmission thereafter. Unfortunately, I couldn't prepare our latest experience about asymptomatic transmission because it's under publication. So maybe we will show the result later. But we have as much of the viral load from asymptomatic people as the symptomatic people. So if the summary of the epidemiology or the incubation period is 14 days, I think all Korean cases was likely to in between this incubation period. We have some people who have a longer incubation period is suspected, but we more likely suspect multiple exposure rather than increase the period of incubation time. And the droplet transmission is most possible way of transmission, but we still use the airborne precaution. When the infectious disease specialist was aggregated in mid-January, 100% of our colleague was supporting that we need the airborne precaution like Ebola virus or MERS outbreak. So although this virus is, some people say that N95 mask is sufficient, Korean hospital was armed with more face shield and more protective devices from the beginning. So this conservative approach probably helped that we have less hospital care infection thereafter. And non-respiratory transmission is quite unlikely. Although not dominantly, we suspect that this virus can transmit asymptomatically. If we remember, the MERS virus can transmit asymptomatically between camels, so but not from human. So it could be also transmitted to asymptomatic periods. So this is the figure of the. I think you heard about. You read this paper. So this paper says that there's more virus shedding from upper respiratory tract infection in early time than probably the delayed patient with pneumonia. And also this figure also shows that there's a virus shedding in between asymptomatic period. Probably the next slide should be our coming data. So I'll be happy to share our data thereafter. So asymptomatic transmission, although overestimated, because some people conspicuously think that the asymptomatic transmission is dominant, but actually it isn't. But it truly exists, and it should be included one of the characteristics of this virus. So in Korea, we mainly screen the symptomatic patients. So officially, the testing is required for symptomatic patients, but we have the experience of many testing for outbreak situation in Daegu. And also, people are very likely wish to have tested even they have a minor symptoms. So, and also they are wishing having the result quickly. So probably the large number of testing in this country is explained by how people wish to have the testing, even they don't have symptoms or minor symptoms. And if the asymptomatic transmission occurs, this could rapidly progress to symptomatic pneumonia thereafter. So risk factor of COVID-19 complication is well known from Chinese data, but which is in blue is our experience in Korea. So we have more cancer and also psychological disease patients because of, in early period we have an outbreak in psychiatric hospitals. So the number of psychiatric patients having COVID and become ill was included in our cohort. And also the Shincheonji region is one of the risk factor in this country because there's many people from the Shincheonji outbreak, and the eldest people in this religious group have died. And if we compare the case fatality rate from China, Italy, and Republic of Korea, it's almost the same. But we have a slightly less fatality compared to Italy. Because in Italy, there's so much increase of the number in short periods, so they probably have a breakdown of hospital resources. But we have to be to consider the pitfall of interpretation during pandemic because this outbreak is not over yet. So it's too early to conclude that the fatality is low because if we see at the end maybe there's many older people can have a severe infection and a prolonged complication thereafter. We may have more deaths at the end of the epidemic. And also, I think it's crazy to compare from country to country because you have a different population, different resources, different culture, which definitely have a different kind of diagnostic tools. So, I don't agree that South Korea is getting better because maybe it's because we are testing a lot of patients. This is a picture of an image in one of the French articles. You see the baby is saying that they wanna be immunologist, infectious disease specialist. Okay. So the clinical manifestation. So you see our nurse group working in ICU and with the PAPR devices. And I think you already know a lot about the incubation period, the symptomatic period. So this is the paper from, I remember in recent paper, but compared to this paper, we have our cases in Korea is less severe. We have more patients without respiratory distress and just having isolated and even not requiring oxygen. But I think the Chinese experience have a more severe cases in Wuhan because there's a large outbreak at that time. Clinical manifestation of SARS-CoV, usually in the literature it says mild pneumonia, 80% of mild pneumonia, but I think in Korea it's 80% of even upper respiratory infection, just like flu. Case fatality is known. But however, if we see the pneumonia, it seems very severe in radiologically because even the patient doesn't have a symptom. If we do CT, we see many times the bilateral pneumonia. So this is concurrent in our experience. So you see how this is the one Chinese cases in the early period in Wuhan. So he died in 19 days of the diagnosis. This is the first case of COVID-19 in Korea. You see that in chest X-ray was negative, but in CT we can see multiple ground glass opacity, which is significant of COVID pneumonia at the early time. But the patient didn't have really distress symptoms at that time. But the problem is doing CT for COVID cases is very difficult. We need isolated devices to isolate patient, and it took time, it took money, and it took very difficult effort to have that result. And this is our experience of olfactory taste disorder. So this patient is 42 old male. He is asymptomatic. He's just come to visit because he has a close contact to his family. So he's the family member of the close contact. So the man was in self-quarantine. So he came in 2 weeks later just to screening of with asymptomatic visit. But he was diagnosed of COVID-19 in 14 days screen test. So he at that time he said he didn't have symptoms. But if we questioned him, he told us that in second day of close contact, he has a metallic taste for 2 weeks. So the metallic taste was a unique symptom during his incubation time. And then after the admission to hospital, he had in day 17, he got pneumonia, bilateral ground glass opacity. So we have reported these cases to paper. So this is interesting cases because the first case symptom was olfactory taste disorder. But this give a great fatigue to our hospital staff because in the screening hospital staff, if the patient comes to hospital, we have one more question. Do you have any test disorder? So it gives a big stress to our hospital staff because we need to ask this question additionally because of that experience. So this is the diagnostic war against the COVID-19. So I will show our colleague in Incheon Hospital. He's an infectious disease specialist in Incheon. Incheon is the airport city of Korea. So because he's an infectious disease specialist nearest to Incheon Airport, he is always having infectious disease cases from every country. But we were thinking about how we can screen better. So in the night, we have a social media communication with among infectious disease specialists, and he gave the idea. So this was his idea, his own idea of drive-through testing. So this is the first time in the world that he's another kid. So he proposed that figure in, I remember it was 4 o'clock in the morning. So every infectious disease specialist was awake at that time. So we was giving appreciation to him. So do that. So this was done first time in Daegu, in Korea. And some paper shows the CT finding is sometimes earlier than PCR. So, but I told you that testing CT is a very difficult job for clinician. CT is a very difficult job. We need a special equipment to handle the suspected cases to the CT. So we can do limited CT for people who have suspected COVID-19, and it's very expensive as well. So for prevention, I think we know there's no great answer than infection control and non-pharmacological testing. We have some group who started to think about post-exposure prophylaxis for healthcare workers, but after we have proven that hydroxychloroquine is not efficient treatment, so this was discouraged. So this clinical study was designed, but discouraged. And also we have no specific hope from immunization research. So when I was sent to Gumi Hospital, one of the smallest hospital of our affiliation, I made the negative pressure room because this hospital was lacking negative pressure room. And we are making the separate zone. So we are taping the pathway for clinician. The blue is clean, red is contaminated. So we have to do many effort from zero ground. You know, we have a limited resource. We are not specialized for COVID outbreak. So we have to change our hospital to be more properly responding this outbreak. This is one of the questionnaire made by our colleague, Professor Park. So he asked to our colleague, the infectious disease specialists of this country. We have 215 infectious disease specialists in Korea after World War II. So my number is 59. So we have a very small number of specialists in this country. So you see what do you feel most insufficient? So from this questionnaire, most of the doctors answered that healthcare workers number is insufficient, negative pressure rooms was insufficient, and infection control practitioner number was insufficient, and PEP was like N95 was insufficient. And also the research responsibility, because many infectious disease specialists was working in teaching hospital. So they have a feeling of a great responsibility for research, but actually it's very difficult. It's just like war situation. It's very hard to concentrate academically. So we was just wondering how the Chinese could write this paper so quickly, because they have many population probably. But here we was more focused on clinical care, because I am professor. I am teaching staff, but in this situation, we are just like a warrior. So we have to protect our people. So first was our service to protect people, but many of the specialists feel responsibility to create data academically, but was not very easy. What will be after this pandemic? So because they first closed their market and they shut down Wuhan city. And thereafter, they extended the New Year's holiday. So I think what really made the disease stop is not shut down, but rather the social distancing. Because after they extend the holiday and they made all people stay at home, they probably successfully reduced the number. But China is probably more authoritarian country than Korea. So we expected that in Korea that it would not be that easy, because you know this is more liberal, free country. So it will be possible to make people to stay at home. It's a great question in early period. But this is our advantage because Korean hate delay. So if something happen and something happen in country, people should know. So they hate the mistransparency. So this is the number of the text message I received from government. So every citizen or every smartphone holder, even not citizen, they receive that kind of message. So you see, they say, Songdong District Office, 9th patient. He live in Peach Street, and she is a 21 years old girl from Canada and was diagnosed. Her home is clean, and she moved to. So they showed the place that she went. So what she used, which buses, which metro, and which shopping mall. And this figure in map was made by government directly from the regarding her credit card message. so many information was aggregated to have that data. So you see, so every citizen can see what place is dangerous or which place is suspicious. So they could. So people who was in this pathway, if they have cough, they directly come to district office to have testing. So that worked during this pandemic in this country. And also the public mask supply. So I don't think, we believe that North Korea is a crazy country. North Korea is a communist country, and our country is a free, democratic, liberal country. But in terms of healthcare, I'm pretty sure that South Korea is more communist than North Korea because we have a public mask supply from government, you see. And this so KF90 masks, we have a unique standard of healthcare mask in the world. So in most countries, we only have a surgical mask and N95 mask. But in Korea, we have healthcare masks, which was just made to protect people from pollution. So what the first intention was to protect people from pollution from China. So we were culturally easy to use mask even before pandemic. And these 2 masks every citizen, I can buy 2 masks every week, and it costs 3,000 won, and it's about 160 Argentina peso. I don't know how much is it for you. And also you see the map of the pharmacy and also the accurate number of reserve of masks they have. So we can Google the map and reach the pharmacy to get the mask directly. And we have a discussion of regarding herd immunity. So I will tell you about the mathematics that most people hate. So if we put R0, R0 like 3 for this outbreak, this is the function of the minimum population threshold for herd immunity. So if we put R0 as 3 for COVID-19, and when I calculate the minimum population threshold should be infected for COVID-19 to protect 100% of the population, it should be 66% of the population should be infected of COVID-19, so that we have the remaining 34% of the people protected freely. So I hope you understand this. So assuming that calculation, it must be like 33 million of South Koreans should be infected of COVID-19 to have protection. And if we put 2% of fatality, it must be like 660,000 deaths in South Korea. Because I am older than 40, like many of Mr. Ambassador and old people, so we probably have a higher probability for death. So I'm sure that if the herd immunity policy applied to this country, I'll be more likely to include to 660,000 people than the remaining safe people. So maybe this works some European country, but I think considering the density of the population and also the reluctance, the acceptance of that situation, the Korean will not tolerate that policy. And so there's some political debate for early whether to block Chinese border or not. So this is a great question among our Korean people, because South Korea actually is re-divided politically from left to right. So because the left side politician, right side politician. So I think this question is about economy versus healthcare. But many people think that it's a pro-Chinese or anti-Chinese attitude. So, but I'm not really interested on diplomatic issues. But it's less likely, because at that early moment, the blockade was very important. And also the discussion of telemedicine, and also some conspicuousy, and also the reluctance to aggressive policy. But in Korea, unlike the North America, we have a less reluctance to aggressive policy. I will tell you why. Because this is the figure of Korean versus Western attitude. When I say the Western is both America, South and North, and EU and Australia. So in Korea, if we have a disaster situation, this may angry. This make people angry. In Western country, this make people sad. It's very different. So if the Korea think the government is cause of disaster, the president is this cause. So doctor is alleged accomplice. But in Western country, disaster is only the government task to solve. So it's very different. And so they upload this for doctor and nurses. But regarding tracing information open to public, people say, wow, in South Korea. But in Western country, WTF. Because they think the personal privacy is democracy. But in Korea, transparency is democracy. Because if you remember in the early slides, what happened in Korea, so what people really wish to have. And self-quarantine is to protect the individual from criticism. Because if I don't quarantine myself, I'll be criticized from people, my friend, my colleague. So we are very fair to be criticized from people. But in Western country, self-quarantine is very hard to predict people's support. So this is probably the difference of culture. And this figure is Professor Kim Tak in Suncheon University. His son drew this figure. This is the risk management of Suncheon University Hospital. You see the detail, how detailed is so the equipment is exactly what is required. So this is my last slide. We see the nurse, she is very happy to finish her duty. I hope that our experience helped to us, and we are very happy to have a question thereafter. Thank you.